We can put this information from the blood tests, from the biopsy, from the diagnostic PET scan, the bone marrow together to look at the scoring system that we use in follicular lymphoma. And for many years, we've used the FLIPI score, which is the Follicular Lymphoma International Prognostic Index, which uses 5 clinical variables. Now, the FLIPI score was created in the era before rituximab and is somewhat difficult at times to calculate because it does require the assessment of the number of nodal sites involved, which can be a little bit difficult to calculate. So we now have the FLIPI-2 score. So this is a prospectively evaluated prognostic scoring system, which uses 5 clinical variables for us to be able to assign a risk assessment, 3 different categories for individual patients. So they fall into a high, intermediate, and low risk group, each with distinct progression-free survivals, each with distinct overall survival, and validated in the era of rituximab. Now, because this patient has a number of features, it puts them into the high-risk category, so that patients with high-risk FLIPI-2 scores with follicular lymphoma have a worse progression-free survival, worse overall survival. The overall survival at 5 years, we probably put somewhere in the order of about 50–60%, and for the progression-free survival, unfortunately, it's pretty poor at about 20% or thereabouts. So this patient falls into a really high-risk group of patients with follicular lymphoma. The key point in the diagnosis of follicular lymphoma is having a good biopsy, and we really encourage the use of an excisional biopsy. So with the biopsy, we can obviously make the diagnosis, and we can also define the grade of follicular lymphoma. So follicular lymphoma is in 3 different grades: grade 1, 2, 3, and it depends on the histologist's assessment of the number of centroblasts in each high-powered field. We subdivide grade 3 follicular lymphoma into grade 3A and grade 3B. Grade 3B has a diffuse infiltration of centroblasts and is much more akin to diffuse large B-cell lymphoma and is treated in that way. Grade 3A follicular lymphoma is very similar to grade 1 and grade 2 follicular lymphoma and is more common. In this case, the patient had grade 3A follicular lymphoma. As with all lymphomas, the patient will require some imaging, and the PET-CT has become the standard of care in this diagnostic pathway. So this provides us with baseline information for us to compare with the end of treatment PET, which is prognostically very important, but also is increasingly being used to give us some greater risk assessment. So the total metabolic tumor volume is an emerging biomarker for prognosis in follicular lymphoma. The patient will require blood tests. The blood tests include a full blood count with assessment of hemoglobin, white cell, and platelets, obviously, the standard biochemistry for renal and hepatic function, but also an assessment of the lactate dehydrogenase, which is useful for calculating the FLIPI score, and the beta-2 microglobulin, which is often raised, and that's used for calculating the FLIPI-2 score and for also the new PRIMA PI. We also assess virology when using any rituximab, for example, and we do an assessment of the immunoglobulins for patients. So once we've got all this information, we're able to provide useful diagnostic information, and we're able to provide prognostic information to help guide our therapeutic choices.